Hello, my name is Aaron McDonald, and I am a professor in the Department of Health Services Administration, and it is my honor to introduce Sydney Shepard and her honors thesis project.
Hi, my name is Sydney Shepard, and I have done my thesis on the perceptions of COVID-19 vaccinations among college-age students. Despite being considered one of the most successful public health achievements, vaccinations are observed as unsafe and unwarranted by a growing number of individuals across the globe. For vaccine programs to be successful in reducing the prevalence of vaccine-preventable diseases, uptake levels must be high. While the high rates of childhood vaccines in most developed countries reveal that vaccinations remain a widely spread public health measure, the national estimates hide clusters of under-vaccinated individuals. Through shadowing a pediatrician in northern Kentucky, I was exposed to vaccine-hesitant parents, which was something that was completely foreign to me. I was intrigued and curious to learn more about this particular population of individuals. Vaccination hesitancy is set on a continuum between those that accept all vaccinations with no doubts or questions and those that do not accept any vaccinations whatsoever. Therefore, it's a heterogeneous group of individuals that lies between these two extremes. I was also very curious in determining the perceptions of vaccinations among college-age students in my age demographic. There were studies conducted to observe the uptake rates of vaccinations among college students and found that college students do not see vaccinations as a high priority. This is because they're in the times of their lives where they finally can make their own healthcare decisions and choose to not prioritize vaccinations. Because of this, I also was very interested in this particular demographic of college-age students 18 to 24 because they're not particularly well studied in vaccination studies. Therefore, when COVID-19 hit, it was the perfect time and it was the perfect storm for my study. COVID-19 has expressed and stressed the importance of perceptions of vaccinations and vaccinations in general. Therefore, it was the perfect time to send out a study to see the perceptions of vaccinations among college-age students of a then-future COVID-19 vaccine. During our literature review, Professor Aaron McDonald and I found a study done by NKU that was examining the similar things that we were looking to examine. The study was focused on college-age students' perceptions of an H1N1 flu vaccine during the pandemic. Thus, we got into contact with the authors of this study and worked in collaboration with them to determine the types of questions that we wanted to ask in our own study. While designing the survey, a main goal was to determine the perceptions of vaccinations and see if these perceptions had changed due to COVID-19. Dr. McDonald and I also chose to focus on descriptive statistics in order to easily compare the feelings and perceptions of our population and determine if they are vaccine hesitant or not. We used EKU Qualtrics as the platform that we entered our 24-question survey into. We obtained the link from EKU Qualtrics and sent it to professors across campus who sent it to their students. Dr. McDonald was also in contact with students and professors from UK and NKU, and they were able to fulfill our survey. I also posted our survey on my social media accounts and asked that students any ages 18 to 24 complete our survey to get their perceptions of the vaccinations. We sent out our survey for 2 weeks from November 27, 2020 to October 27, 2020 to November 9th, 2020. We received 546 responses and we used 521 of those responses and we threw out the other ones because they had incomplete data. The majority of the responses were from EKU and NKU, but we also had responses from UK and other unnamed colleges and universities. We concluded that 68% of our population was COVID-19 vaccine hesitant. It was also found that 28% of our population would refuse to get the COVID-19 vaccination even 1 year after it being on the market. Further, for 47% of our population, the newness of the vaccination was the main contributing factor as to why they would not receive the vaccination immediately. A bivariate correlation analysis and chi-square tests were run to determine if the individuals with the highest concern for COVID-19 and those who were most likely to get the vaccine immediately had a correlation and an association, and the test determined that there was an association between these two variables. Thus, the results of the study provide a jumping-off point for further research and researchers to continue to examine the vaccine hesitancy of this specific target population of college-aged individuals. During the time the survey was sent out, the incidence of COVID-19 cases among young adults ages 18 to 24 increased with the most rapid rate and the highest incidence across all age groups in the United States. Therefore, knowing that 68% of our population was COVID-19 vaccine hesitant allows for universities to create vaccination campaigns to help alleviate hesitancy in their studies and for their students so that they can help them to negate information that is misnomers about vaccinations and the vaccine approval process that the FDA has required. One of the limitations of this study is that the demographics of the study were predominantly white or Caucasian. Therefore, the population of individuals was not representative of the university's populations that we sent the survey to. Thus, in a future study, the main goal would be to obtain the perceptions of COVID-19 perceptions in minority populations. This is of vital importance because the current literature shows that vaccination hesitancy is highest among ethnic and racial minorities in the United States. Another limitation of the study is at the time of the survey, the vaccine was still in development, and while the survey was still ongoing, it was set to the public. The vaccine went from development to market at a very rapid speed, which was unlike anything we had seen before. The next steps from this point forward are to start creating vaccine campaigns that address the concerns of vaccine-hesitant individuals on college campuses. Also, I would like to send out a similar study that focuses on minority perceptions of COVID-19 vaccinations uptake rates, and to expand the survey to other states and other areas in the United States to understand the perceptions of vaccinations in college-age students across the United States. I would like to take this time to thank Erin McDonald for helping provide me guidance and mentorship through this project, and also thank the Scholars Day Committee and panel for giving me this opportunity to share my research. Thank you.